Picture this. You're living in medieval Europe. You're not feeling well, so you call for a doctor.
Right, as you do.
But when the physician arrives at your door, they don't, ask you to say, they don't even take your pulse.
They might not even look at your body at all, honestly.
Exactly. Instead, they ask for a sample of your urine, and they pour it into this special, this rounded glass flask called a matula.
Yeah, the matula. It's iconic.
Right, and they hold it up to the sunlight, they swirl it around, they're checking the clarity, the sediment, the color, and yeah, they even take a good long whiff of it.
Yep, the smell was a major diagnostic criteria.
Which is just wild to think about. But based entirely on that flask of pee, they give you a diagnosis. I mean, these traveling doctors were so common and their methods were so highly specific that they actually earned this derisive nickname. People called them the piss prophets.
It's such a great historical detail. I mean, the visual of a medieval practitioner holding up a glass flask to the sun, that is essentially the defining image of historical medicine. For centuries, the absolute pinnacle of diagnostics wasn't a physical exam of the patient's body. It was a visual and olfactory inspection of human waste.
It's crazy to imagine trusting your life to someone swirling a flask, but it perfectly sets the stage for our mission on today's deep dive.
Let's get into it.
So we are taking a stack of medical terminology texts, and we're zeroing in on two foundational roots that basically define this entire bodily system. And those are cysto and uro.
The big ones.
Yeah. The goal here is to really demystify these terms. We want to give you, the listener, the tools to actually decode your own medical charts. Like, when you see a UA result pop up on your patient portal, we want you to know what that means.
Which is so empowering, honestly.
It really is. And along the way, we're going to uncover the surprising and frankly sometimes very messy history of how these ancient words evolved into the language of modern medicine.
And as you listen today, you'll see how these ancient words aren't just dead history. I mean, they actively shape modern surgical decisions.
Right.
They define major public health crises, and they even dictate the often arbitrary boundaries of which specific medical specialist is actually allowed to treat you.
Okay, let's unpack this. Because I know medical terminology often looks like an intimidating, impenetrable foreign language.
Oh, absolutely. It looks like alphabet soup.
Right, but it's actually just a set of linguistic Lego bricks.
That's a perfect way to describe it.
Once you know the base pieces, you can build or deconstruct almost anything in the medical dictionary. So to understand that modern medical chart, we have to start with the literal translation of those bricks and the ancient Greek physicians who first laid them down.
Yeah, so the two main pieces anchoring this whole system are cysto and uro.
Okay.
Starting with cysto, this combining form means bladder. And in modern clinical settings, it almost exclusively refers to the urinary bladder.
Right.
It comes from the ancient Greek word kystis, which originally it just meant a pouch or a sack, nothing specific to urine.
Just a bag, basically.
Exactly, just a generic bag.
Oh.
Then we have uro, which means urine, or more broadly today, the urinary tract.
Okay.
And that comes directly from the Greek word auron, which literally just means urine.
So kystis for sac, auron for urine.
Mm-hmm.
Got it. What confuses me, though, and maybe you can clear this up, is that the Greeks coined these terms, thousands of years ago.
Right.
But classical Greek medicine effectively collapsed in Western Europe during the Dark Ages.
You did, yeah.
So how on earth are we using their exact words in modern American hospitals today?
It's a great question. The survival of these words really relied on a massive, centuries-long game of geographic telephone.
Geographic telephone, I like that.
Yeah. So in the 2nd century CE, you have this Greco-Roman physician named Galen, and he heavily systematized this anatomical vocabulary.
Okay, so he organized it.
Right. But when the Western Roman Empire fell, that knowledge didn't just disappear, it migrated. The Greek texts were preserved by Byzantine scholars, and then they were translated into Arabic.
Oh, wow.
And that became the foundation of the Islamic medical golden age.
Wait, so the terminology shifts over to the Middle East while Europe is, largely relying on just local folk medicine?
Precisely. Europe was in a very different place medically. And the pivotal figure here in the Middle East is this 11th century Persian polymath, Ibn Sina.
Okay.
In the West, he's commonly known as Avicenna. He wrote this massive work called The Canon of Medicine.
The Canon of Medicine.
Right. It was an incredibly dense, highly organized encyclopedia. He basically compiled and refined all this Greek, Roman, and Islamic medical knowledge into one place.
That's a huge undertaking.
Massive. And by the 12th century, the canon was translated back into Latin.
Ah, there it is.
Yes, and it completely dominated European medical education for the next 500 years. I mean, it essentially locked these ancient concepts and their corresponding root words firmly back into the Western medical curriculum.
Okay, that makes sense. That explains how the ideas actually survived the centuries. But the way we learn medical terminology now, the root, the combining vowel, the suffix.
Right, the formula.
Yeah, that highly mechanical, almost mathematical structure, that wasn't how ancient Greeks or medieval scholars were speaking, was it?
No, not at all. The systematic teaching method we use today is really a 19th and 20th century invention, and it was born out of absolute necessity.
Why? What was happening?
Well, during the 1800s, anatomy and pathology were becoming these rigorous international sciences. But the medical vocabulary was a complete disaster.
How so?
Doctors were using all sorts of local slang, overlapping Latin phrases, and just thousands of eponyms.
The eponyms.
Yeah, meaning diseases or body parts named after the guy who discovered them.
Oh, right, like Parkinson's or something?
Yeah.
I can imagine the chaos, a doctor in London trying to consult with a doctor in Vienna.
Exactly.
And they realize halfway through a letter that they're using 3 different names for the exact same bladder condition.
It was a serious barrier to scientific progress. I mean, you can't have an international scientific community if you don't speak the same language.
Right.
So this forced the creation of projects like the Basel Nomina Anatomica in 1895.
Okay, what was that?
It was an international effort to just strip away all the slang and the eponyms. They created a single, standardized list of anatomical terms derived strictly from Latin and Greek.
Ah, so they standardized the Lego bricks?
Exactly. And that project evolved throughout the 20th century into what is now the Terminologia Anatomica. It ensures that cysto and uro mean the exact same thing everywhere on the planet.
Okay, so the linguistic foundation is poured. We've got our standardized Greek and Latin bricks. But how did we get from the piss prophets staring at flasks of pee to the incredibly precise surgical specialties we have today?
Well, technology had to catch up.
Right, because looking at pee only tells you so much about the organ itself. There was a technological breakthrough that changed everything, right?
There was. It takes us back to late 19th century Germany. In 1879, a German surgeon named Maximilian Nitze invented a device called the cystoscope.
Okay, cystoscope. Let's break that down.
Right, so cysto meaning bladder, and scope meaning an instrument to view. Instrument to view the bladder.
Yeah.
Here's where it gets really interesting to me. Nitze essentially invented the check engine light for the urinary tract.
That's a great analogy, yeah.
He took us from guessing what was happening behind a locked door, or, literally just feeling around the outside of a patient's abdomen, to simply opening the door, turning on a flashlight, and looking around inside.
That is exactly what he did. Nitze built this delicate metal tube with a series of lenses and, crucially, a built-in electrically heated platinum wire for illumination.
Wow.
Before the cystoscope, diagnosing bladder tumors or stones was highly speculative. You just couldn't see the tissue.
You were just guessing.
Pretty much. But after Nitze, a physician could look directly at the mucosal lining of a living bladder. And the impact of being able to finally look behind that locked door was just immediate.
I bet.
It caused the entire field of urology to splinter off from general surgery and become its own distinct, highly specialized discipline. Right, because suddenly if you have this complex optical tool, you need specialized training to insert it, operate it, and interpret what you're seeing.
Exactly. It creates a walled garden of expertise.
Yeah.
The founding of the American Urological Association in 1902 was a direct result of this technological shift.
Wow, just from that one tool.
Yeah. And this brings us to a fascinating linguistic phenomenon. Scope drift.
Scope drift.
Yeah. Originally, urology literally meant the study of urine and the organs producing it. But today, if you go to a urologist, they treat kidney stones, bladder cancer, and the prostate and testes.
Oh, right.
Because the male reproductive and urinary tracts share so much physical real estate, specifically the urethra, the working definition of uro, just stretched. It expanded to encompass the entire male reproductive system as well.
It's a bit like how the phrase dialing a phone survived into the smartphone era.
Oh, that's a good point.
Right. The original physical mechanism, the rotary dial, is completely gone. But the word just absorbed the new technology. The root uro did the exact same thing. It absorbed new anatomical territory as the surgical tools advanced.
It's perfect parallel.
Yeah.
The language expands to fit the reality of the clinic.
Now, wait, I need to stop you there and talk about when this system fails, because the sources brought up the term uremia.
Ah, yes, uremia.
So uro meaning urine, and urine meaning blood condition. Literally, urine in the blood.
Right.
How is urine a liquid created in the bladder getting backward into the bloodstream? Or am I just misunderstanding the biological mechanism here?
You are interpreting the words literally, which makes total sense based on our rules, but the biology is a bit more nuanced.
Okay.
Uremia doesn't mean fluid urine is backing up into your veins. It describes the deadly buildup of urea and other toxic waste products in the bloodstream when the kidneys fail to filter them out.
Oh, I see.
So the waste that should become urine is instead trapped in the blood.
Got it. So it's the ingredients of urine, not the final product. And that condition gives us one of the most incredible survival stories in medical history, the Willem Kalf story.
Oh, it's an amazing story.
Can you walk us through it?
Sure. So it's 1943. Willem Kalf is a Dutch physician working in a small hospital in the Netherlands, which is currently under heavy Nazi occupation.
Right in the middle of World War II.
Exactly. His patients are suffering from acute kidney failure. They are dying a terrible death from uremic poisoning, and he desperately needs a way to filter those toxins out of their blood.
But he doesn't have any supplies, right?
Right. With resources severely rationed by the war, he just scrounges together materials to build the first functioning artificial kidney.
And when you say scrounges, I was reading this and I couldn't believe it. He built this machine out of cellophane sausage casings, orange juice cans, and a wooden washing machine drum.
It's unbelievable.
It sounds like MacGyver,
Yeah.
but it actually worked. How on earth do sausage casings filter blood?
Well, Kalf understood the principle of osmosis and semi-permeable membranes. He used the cellophane sausage casings as that membrane. He would actually pump the patient's toxic blood into the long cellophane tube and wrap it around the wooden drum.
Oh, wow.
Then, he submerged the rotating drum into a bath of carefully mixed saline solution.
Let me make sure I have this right. So the microscopic pores in the sausage casing allow the tiny molecules of toxic urea to slip through into the saline bath, but the larger red blood cells stay trapped inside the casing.
You nailed it. The toxins diffuse across the membrane from an area of high concentration in the blood to low concentration in the bath.
That is so clever.
And then the clean blood is just pumped right back into the patient's body. It was crude, it was frankly terrifying, but he managed to rescue a patient from a uremic coma using this exact device.
That is wild.
It is the absolute genesis of modern dialysis, a life-saving technology that millions of people worldwide rely on today.
It's amazing to think about that leap. From medieval uroscopy to an improvised wartime dialysis machine to what we have today.
It's a huge jump.
Let's transition from that extreme history to how this vocabulary shows up in our everyday lives right now, because you're going to see these Lego bricks everywhere once you know them.
Oh, absolutely. We can start by breaking down one of the most frequent reasons adults visit a primary care doctor, which is cystitis.
Cystitis, okay? Cysto, the bladder root, plus secundus, meaning inflammation. So inflammation of the bladder.
Exactly.
This is the clinical term for a standard urinary tract infection, or UTI. But why is this such a massive issue? The texts mention it's primarily driven by E. coli, which is a bacteria that lives completely harmlessly in our gut.
Right.
Why is it fine in the intestines but causes violent inflammation the second it hits the bladder?
Well, it comes down to the environment. The gastrointestinal tract has evolved an incredibly robust mucosal barrier. It's an immune environment designed to just coexist with trillions of bacteria, including E. coli.
It's used to them.
Exactly. The urinary tract, however, is meant to be completely sterile. The lining of the bladder just does not have those same defenses. So when E. coli migrates just a few inches from the GI tract to the urethra and travels out into the bladder, it adheres to the bladder wall and just multiplies.
And the immune system treats it like an alien invasion.
Bingo. It causes the intense pain and inflammation of cystitis. And the real public health crisis here is that these routine infections, which we've historically cured with a quick round of basic antibiotics.
Let me guess, antibiotic resistance.
Yes. They are becoming increasingly resistant to our drugs. As E. coli mutates, cystitis is transforming from a minor annoyance into a genuinely dangerous infection that can actually travel all the way up to the kidneys.
Which is really scary. Speaking of severe bladder issues, what about cystectomy?
So cysto plus cystectomy meaning surgical removal.
Right.
Because it's the surgical removal of the urinary bladder. It's almost always performed to treat invasive bladder cancer.
The sources point out that smoking is the single largest modifiable risk factor for bladder cancer.
It is.
This feels like a huge piece of public health messaging that gets missed. I mean, people always associate smoking with lung cancer, but how does inhaling smoke destroy a pouch sitting in your pelvis?
It's a great question.
Yeah.
When you inhale tobacco smoke, all those thousands of carcinogenic chemicals enter your bloodstream.
Okay.
Your kidneys, acting as the body's filtration system, dutifully pull those toxins out of your blood and dump them straight into your urine.
Oh, no.
Right. But urine isn't immediately expelled. It sits and pools in the bladder for hours at a time.
Oh, man. So you just have a highly concentrated pool of liquid carcinogens just soaking into the mucosal lining of the bladder.
Exactly. Mutating the cells over time. A lifetime of smoking essentially turns the bladder into a toxic holding tank.
That is a horrifying image.
It is. And it makes a cystectomy necessary when tumors deeply invade the muscle wall. Symptoms usually begin with something like hematuria.
Let's break that down.
Sure. Hemato meaning blood, and uria meaning a condition of the urine, blood in the urine.
It's unsettling to think that everyday habits, or, bacteria migrating an inch, can cause such massive health crises.
Yeah.
But it's not just our internal biology causing these issues. The environment is literally shifting our diagnoses. I was reading the sources about this geographic phenomenon called the kidney stone belt.
Yes. The kidney stone belt.
What exactly is happening there?
So this involves the medical term urolithiasis. Uro for urinary tract, and litho meaning stone.
The formation of stones.
Right, anywhere in the urinary tract. Epidemiologists have identified this clear geographic pattern in the United States where the prevalence of stone disease is just remarkably high.
Where is it?
It's concentrated heavily in the hot, humid southeastern states.
Wait, so the climate itself is causing rocks to form in people's kidneys? How does it even work?
It comes down to chronic, low-level dehydration.
Really?
Yeah.
Just not drinking enough water.
Pretty much. In warmer climates, people lose more fluid through sweat. If they aren't drastically increasing their water intake to compensate, their urine volume drops and becomes highly, highly concentrated.
Oh, I see.
The minerals in the urine like calcium and oxalate, they reach a point of supersaturation and crystallize, forming stones.
Wow.
And as average global temperatures rise, researchers are actively watching this kidney stone belt expand further north and west.
That is wild. It's a perfect example of how environmental factors directly drive the frequency of these ancient medical terms showing up in modern clinics.
Absolutely.
And bringing it back to the scope drift we talked about earlier, where Euro expanded to include male reproductive health, this is exactly why campaigns like Movember exist every autumn.
Right, the mustaches.
Yeah, that mustache growing campaign is specifically raising awareness for prostate and testicular conditions. Those all fall squarely under the urology umbrella.
Which is funny when you think about it. The medical specialty, whose very name is built on the ancient root for urine, is now the primary surgical and clinical guardian of male reproductive health.
Okay, so this whole system of roots, suffixes, and anatomical boundaries, it seems highly logical on paper, very neat and tidy.
On paper, yes.
But the texts highlight that when words look and sound too similar, or when ancient roots refuse to die, it creates absolute chaos in the real world.
Oh, it really does. The system is logical, but clinical medicine is practiced by exhausted humans in high-stress environments.
True.
When terminology relies on incredibly subtle linguistic distinctions, human error just becomes a major factor.
Right. And the most notorious mix-up in the clinical world doesn't even involve the bladder root. It involves a one-syllable danger. Uretero versus urethro.
Ah, yes. The classic mix-up.
Let's lay it out.
So, the ureters uretero are the two paired muscular tubes carrying urine from each kidney down into the bladder.
Okay.
The urethro is the single tube carrying urine from the bladder out of the body.
So what does this all mean for a patient? Think of it like this. The ureters are the entrance ramps, bringing high-speed traffic down from the kidneys into the bladder.
Good analogy.
The urethra is the exit ramp, taking traffic out to the exterior. Mixing them up is literally like confusing the entrance ramp with the exit ramp on a massive interstate.
A disaster.
If a surgeon misreads a chart or mishears a handoff, it completely changes the surgical plan.
It is treated as a genuine patient safety hazard in medical and nursing training. I mean, these words differ by a single syllable.
One syllable.
Yeah. In a noisy hospital over a crackly phone line, ureteral stent and urethral stent sound nearly identical, but they refer to completely different procedures with entirely different risks.
So how do they keep it straight?
Medical education places heavy emphasis on drilling this distinction using mnemonics. A common one is tying urethra to exit, since the urethra is the final pathway out of the body.
Urethra exit. That works. Beyond just typos and pronunciation dangers, there's also a major boundary debate happening in medicine right now over these terms, isn't there?
There is, yeah.
Like the arbitrary way we divided up the body 100 years ago is actually causing friction today.
It goes directly back to our discussion of scope drift.
Mm.
So, urology expanded to comprehensively cover male reproductive organs, creating a very unified model of care for men.
Right.
But that historical expansion left female urologic care oddly fragmented.
How so?
Well, if a woman has severe urinary incontinence or pelvic organ prolapse, where the bladder pushes against the vaginal wall, who manages her surgery?
Oh.
Is it a urologist who owns the bladder? Or is it a gynecologist who owns the female reproductive tract?
Wow, it sounds like a bureaucratic turf war that leaves the patient just caught in the middle.
It has historically been a turf war, because anatomy doesn't respect the rigid linguistic boundaries set by 19th century European men. The pelvic floor is basically a shared border.
That makes total sense.
This friction eventually necessitated the creation of a relatively new subspecialty called urogynecology, attempting to kind of bridge the gap.
Oh, interesting.
But there's still active debate about training paths, board certifications, and where the precise border of urology ends for female patients.
It's fascinating how ancient definitions still dictate who gets paid to perform a surgery today.
Isn't it?
Now, I have to bring up the ultimate word-building curveball from our sources. Cystic fibrosis.
I was wondering when we'd get to this.
Okay, follow my logic here. We spent this whole time establishing that cysto means bladder. So cystic fibrosis must be a degenerative bladder disease, right?
If you apply the linguistic Lego bricks we've discussed today, that is the only logical conclusion.
Okay.
But in reality, it is completely wrong.
Mind blown. Where's the flaw in the logic?
Well, cystic fibrosis is a genetic disorder that affects the body's exocrine glands, mostly impairing the lungs and the digestive tract by producing thick, sticky mucus.
Right, the lungs.
It has absolutely nothing to do with the urinary bladder.
Then why on earth is the word cystic in the name?
To understand that, we have to look at the physician who first systematically described the disease in 1938, an American pathologist named Dorothy Anderson.
Okay, Dorothy Anderson.
She named the condition based on her autopsy findings. She observed widespread fibrous scarring and fluid-filled lesions in the pancreas of these children.
The pancreas.
Right. When naming the disease, she didn't use the narrow, modern clinical definition of cysto, meaning urinary bladder. She reached all the way back to the original generic ancient Greek meaning of cystis.
Which simply meant any sac or pouch.
Exactly.
Oh, so the lesions were little sacs, little cysts, scattered throughout the pancreas.
Exactly. It's a vivid reminder that word roots keep their oldest, broadest meanings alive in unexpected corners of our modern vocabulary, long after a narrower, specialized meaning takes over everywhere else.
That is so cool.
You see the exact same thing in the word cholecystitis, which is inflammation of the gallbladder. It literally translates to the bile sac.
So the rule cysto means bladder works like 95% of the time until you hit a word that decides to stubbornly hold on to its 2,000-year-old origin story.
Pretty much.
It just goes to show you always have to look at the surrounding context.
Yeah, the bladder default only holds true when no other specific organ or system is referenced in the word.
Okay, let's step back and recap the physical anatomical map we've traversed today using this terminology.
It's been quite a journey.
It really has. We started upstream at the filtration plant, the kidney, which gives us roots like nephro or weno.
Yep.
Then we traveled down the entrance ramp tube, the uretero. We stored that fluid in the holding tank, which gives us our cysto or vesico roots.
Right.
And finally, we exited the body through the exit ramp, the urethra. It really is an incredibly specific map of the human body.
It is a standardized, universally understood map, but if we connect this to the bigger picture, medical language is essentially a living time capsule.
A time capsule, I love that.
We are currently using ancient Greek and Latin words coined by practitioners who diagnosed disease by sniffing a glass macula flask to describe cutting-edge 21st century science.
It is amazing to think that a surgeon programming $1 million robotic arm to remove a tumor is using the exact same vocabulary as a guy in a medieval village holding pee up to the sunlight.
It raises a vital question for the future of medicine, honestly.
What's that?
As artificial intelligence, genetic engineering, and molecular biology continue to radically reshape how we diagnose and treat disease, moving us to a cellular level far beyond what a cystoscope can even see, Will we eventually hit a limit with this terminology,
Oh, that's a good point.
where we need to invent an entirely new, perhaps purely algorithmic language to describe the human body? Or will we just keep stacking wild new concepts onto these resilient ancient Greek foundations?
That is definitely something to chew on the next time you're sitting in a waiting room, staring at a medical form that looks like it's written in an ancient foreign language, because in a very real way, it is. Thank you so much for joining us on this deep dive. Hopefully, you feel a little more armed to decode your own medical charts. And the next time you hear the word uroscopy or hand over a sample cup, just be grateful that your doctor has a whole lot more tools at their disposal than a glass flask and a good sense of smell.